Hey, it's Dr. Chris Banning at the house. We're doing a podcast from the house, and
it's a house cast.
Yes, a house cast. So one of the things I'm really passionate about is helping my patients deal with pain. Now, we get a lot of youngsters that come in and they'll have temporary pain. The ones I really want to help are the ones that are getting older and are really dealing with chronic pain. Did you know chronic pain is the #1 reason people go to see their medical doctor?
No, I did not.
Yeah. It's probably #1 reason people come to see us.
That I believe.
Yeah, so chronic pain, I mean, it causes a lot of problems for people as they get older. One of the biggest problems that I see is they'll get depression, or they'll have a poor quality of life, where eventually it just gets them down so badly, or they have poor mobility, they can't walk around. And oftentimes we'll get somebody that comes into the office and they've tried everything, and our biggest goal is to get them so they can get up off the pot and walk around.
Seriously?
Well, because if you can't get up off the pot, you're going to the nursing home, because nobody's going to clean your butt up.
Not unless you've got a very...
Unless you've got somebody that really loves you.
Yeah,
I mean,
a lot.
You're going to have to get some kind of care eventually, because chances are that their spouse is dealing with some health issues too, if they're just like the average American as they age with chronic pain. So, yeah, and then they'll take a lot of medications, and as we know, you can look it up, but opioids are pretty addictive. Pretty
Yes.
addictive. In fact, a lot of the research that I've read is the only reason you should prescribe an opioid is if somebody is dying and they're terminal. Other than that, you don't, because a lot of the statistics we get tell us that the majority of the heroin addicts started with a prescription medication.
So that is a fact. I used to do a podcast called High Sobriety.
Oh yeah. Okay.
And almost everybody we interviewed, there was one fellow we interviewed who's written a book. He was a federal prosecutor.
Oh wow.
And had a back injury and was put on opioids and ended up robbing a bank and became a federal prisoner.
That's a lot more common than people think. I had a lady who came in to me, and her husband had a failed back surgery, and he actually was in so much pain he got addicted to the opioids, and he went in and tried to rob a Walgreens, and he ended up spending several years in, what's the one, there's one in Knoxville.
Yeah,
I don't know which one it was. She
either.
lived here in Nashville, and she had to commute. The funny thing is he got straightened up. I got to meet him.
Sure.
He spent a lot of time exercising and eating, trying to eat healthy, and he came out pain-free. So
You can detox in jail. It's not the place to do it.
well, mentally you sure do.
Yeah.
Or you get worse.
Yeah.
But anyhow, so that's where our focus is today, and I wanted to just talk about some of the causes of pain. We know, if you fall down and you go boom,
Injuries.
hurts,
Yeah,
right?
that hurts. Yeah.
That hurts. That's a physical form of what we call tissue damage. So tissue damage is actually what sends the pain signal to the brain. So physical damage in the form of large traumas, like a car accident, or repetitive stress traumas like kids are doing to themselves. Looking forward all the time.
Yeah, that's what I was thinking.
Looking at their phone, people sitting at a desk, 6, 7, 8, 9, 10 hours a day for years on end. Sedentary lifestyles, those are all things that create micro traumas, repetitive stress, and accumulate to create trauma to the tissues and damage, and can lead to inflammation. The other one would be chemical causes. We have a lot of those right now in our food supply. A lot of chemicalization of our foods, like MSG, high fructose corn syrup, just carbohydrates. You name, gluten sensitivity. There's a lot of people that are allergic to corn, wheat, soy, and dairy. All these processed foods. I'll give you an example. I did an experiment. It was not an experiment that I planned to do, but somebody had brought home some Honey Nut Cheerios and some Sugar Smacks and some Captain Crunch. Okay, now I lived off of that stuff when I was a kid, but I can't afford to eat that now. I'm almost 60. I need to keep the pain away. So I got mad and I took all 3 of them and I dumped them outside the house, and I said to myself, I wonder if anything's going to eat this, because usually the animals
Oh yeah.
know better than us,
Yeah.
you know. And so it's like a week later and I go out there, we've got somebody that's doing some landscaping, and sure enough it's still there. And then the 3 Stooges, our neighbor has 3 dogs, we call them the 3 Stooges, they're hilarious. One weighs 150 pounds and I'm like, okay, he's come up to this, he will devour this. He just sniffed it and he did not eat it.
No way.
So we still have stuff, and no birds. Birds didn't eat it. I mean,
Wow.
you know, so that just proves that this is not food. It's chemicals, and that is creating inflammation. It's causing tissue damage in our bodies and leading to chronic pain. Another form of that we get chronic pain from would be from mental stress. Mental stress is a big one, especially now that we're dealing with COVID, and we're having a lot of political upheaval in our country, and people are getting stressed out. And so when you get stressed, it affects this organ right here. This is the brain. It's in charge of everything. And so what happens is your body starts to be in a fight or flight response, and your heart rate goes up, your digestion goes down, your bowels may not work, your immune system will shut down, and then your body starts to produce, your brain starts to produce these hormones that support the fight or flight or the inflammatory response in your body. And that's another cause of chronic pain. People just don't know these things that are going on in their bodies. And so we're wanting to tell you about that. But okay, we want to talk to you about a close relative of pain, and its name is inflammation. Inflammation.
Okay.
So inflammation is the driver of all disease. All disease. So we've got physical damage and trauma over a long period of time. That can lead to inflammation. We've got chemical trauma, and that can include drugs too, that can damage tissues and lead to inflammation. And we have mental, okay? And so over time, these can lead to, you know, the plaquing in the arteries. A lot of people think it's cholesterol. Really what happens is if you eat poorly and there's inflammation in your body, cholesterol comes to clean up the inflammation.
Okay.
So a good way to address cholesterol would be to eat cleaner, healthier, and we're going to talk about some other things you can do to reduce inflammation and reduce cholesterol and pain as well. Coronary artery disease, stroke, fatigue, dementia, Alzheimer's, indigestion, leaky gut, autoimmune diseases, chronic sensitivity issues, ADHD, you know, even radicular complaints. See, that's where a lot of this is getting into my category where I have to help my patients. And so it would be like nerve pain, burning, numbness in the hands and fingers, numbness in the feet, burning, all those types of things. And so even loss of memory, you know, kids they can't focus,
Yeah.
things like that. And so we can help that. We can help that with what we're talking about today. So so let's go over, you know, what people try to do for pain.
Okay.
We can just talk about this, right? Because we got all kinds of friends and patients and relatives that do this.
Sure, they take over-the-counter pain relievers.
Yeah.
Most of them.
OTCs.
Yep.
Yes. And opioids, like we talked about.
Correct.
Earlier. NSAIDs. Aspirin. So it's well documented in the literature that people actually die from these things. They'll bleed out.
Yeah.
There's also, you know, they do work. In some cases, they do reduce the pain, but the problem is there's just some serious side effects. And again, we're talking about tissue damage, kidney damage, liver damage, stomach damage, stroke, erectile dysfunction, just a whole bunch of things that these side effects can create for the body. And in many instances, you look at the list of the patient's meds, and I encourage my patients to study what medications are on. I give them a book. It's called drug markers. It's written by a pharmacist.
Mm-hmm.
And so it really helps to get rid of some of the side effects that the drugs are causing. And the other thing, one side effect that drugs cause is they create nutrient depletion. And you know, if you have nutrient depletion, you're going to have all kinds of issues with pain and memory loss. So
Yep.
anyhow,
I don't need my nutrients depleted.
What's that?
I don't need my nutrients depleted.
No, it affects
What
your
few I have.
yeah, your ability to function.
Yes.
So so the goal here is to talk about a nutrient that is depleted in just about everybody, and to offer what I would call a non-medical solution to reducing pain and inflammation.
I love that.
Yeah.
Anything I can do to be better.
Yeah, I've
non-medical.
been using it for the last 20 years. And so there's a group of chemicals in your body, they're called icosanoids. There's about 100 of them. They control just about every physiological process in your body. And there's good icosanoids and there's bad icosanoids. In other words, if you're having issues like, say, you know, if you eat an inflammatory diet, which most people in America do, even though they don't realize it, processed foods, you're going to have a lot of what we call arachidonic acid.
I don't want any of that.
No, don't want to do acid. So what happens is the arachidonic acid turns into a hormone called prostaglandins 2. It's called PE2. And PE2 is the direct mediator of pain in our brain and our nervous system.
I took PE2 in the 12th grade. I had PE1 in the 11th grade.
Oh. Wow. Okay.
I'm sorry.
No, that's good.
I can't help it.
That's funny. That's
These
good.
things just come out.
Yeah,
And
that's all right. Get it all out.
it may be my Icosanoids.
Your
What'd you call
your icosanoids.
them? Yeah, that's it.
Icosanoids, icosanoids, yeah.
I thought an Icosanoid was somebody from the planet Icosa.
It could be.
Yeah.
Yeah. All right.
That's
So
enough. I'll be
yeah,
quiet.
that's okay. We're good. So you know, and we'll take these non-steroidal anti-inflammatories like Celebrex, ibuprofen, what are some? Tylenol, Excedrin,
Acetaminophen.
Advil. What did you just say? Acid.
Acetaminophen.
Acetaminophen?
Yes, yeah.
Kind of fun? Yeah.
Got one.
So yeah, so these things can block pain, but the problem is they have all the horrible side effects. And so who wants to take a pain medication long term? That's not a good strategy.
No.
Not at all. So there's something called Icosapentanoic Acid, EPA, which blocks the formation of PE2, the main pain mediator that gets to our brain. And it produces PE3, which neutralizes the inflammatory response and the pain response. So it's kind of like cold water neutralizes hot water.
Correct.
Okay?
Yeah.
So it shuts down the inflammatory response. Now, why do we have this problem in the first place? That's what a lot of people want to know. And this is something I've been studying on and off for over 20 years. And what it is it's the ratio of omega-6 to omega-3 in your diet.
Yeah, we've talked about that.
Yeah, we've talked about it, and I'm going to get to the point where I'm going to keep talking about it to get people to know they can do this, because I want to help people as they get older where they can be more productive and not have so much pain.
Yeah.
So, and these are many of my friends because I'm getting older. I mean,
we all are.
yeah, we are.
Yeah.
And so yeah, that ratio in the standard American diet is about 25 to 1. Okay.
Wow.
How do we measure the ratio? Well, you can just do a finger prick test and you can get it. And this ratio, or these fats, are in every cell, tissue, organ, and system of your body. They make up everything. They're in your brain, they're in your nerves, everything. And so they're essential. Your body can't produce them, so you have to get them in your diet. Now, there's a guy named Gary Taubes that talks about the theory of everything. And what he's talking about is, if you look at a lot of our big processed food industries, they're all coming from corn, wheat, soy, or dairy. Okay?
Okay.
So we'll be like, well, what are the cows and the chickens and the pigs all eating?
Ooh.
Corn, wheat, soy, dairy.
So it's in the meat.
Okay, I don't think anything, maybe, yeah, the cows are eating their mother's milk, but they're eating all kinds of corn, wheat, soy, and dairy. So these are all omega-6 rich foods, and that goes into the cereals. So it goes into everything that's processed that we eat.
Yeah.
And so our diet is really heavy in omega-6. It's very light in omega-3. Okay, so that sets us up for inflammation. A good ratio is 4 to 1. I've tested myself. I'm really close to 4 to 1.
Are you really?
Yeah, I'm really
Congratulations.
close to it. Yeah, I have to be, just because it really affects me if I'm not there.
I need to see where I am, and I'm going to be a guinea pig. I think I'm going to show. We're going to video my. Yeah.
Well, so I'm not going to let the cat out of the bag yet. I just wanted to put this out there and let people, think about this for a little bit. But people that have a 25 to 1 ratio will have a tendency to have things. Even children have it. ADHD, difficulty focusing, all kinds of receptive disorders where they don't understand things. A lot of just tics and nervousness. Adults can have things like nerve pain, loss of memory, leaky gut. And again, the whole underlying thing is because of this ratio, and it leads to inflammation and chronic pain. So yes, there is a blood test that we can do. It's very simple. We're getting ready to launch it at our office. We want to offer it to our patients first, but I also want to offer it to people listening to the podcast or anybody that's dealing with chronic pain. What we do is we evaluate the ratio of omega-6 to omega-3 in your blood cells, and we're able to use supplements. Now you have to use the right supplement. Okay, there has to be a ratio of something called EPA to DHA. It has to be proper ratio. But what we do also is we recommend that you make changes in your diet. Now you don't have to do that, but if you make the changes in your diet, you'll even notice a bigger change in your inflammation and your chronic pain. And you do this for about 3 months, and then we retest you. Now in many cases what's going to happen, people are going to like, oh my gosh, I can't believe it. I can't believe the changes, okay? But the good news is it's not toxic, there's no side effects, and they've studied this. So, that's what we're wanting to do at White House Chiropractic and Nutrition, and I don't know what else to say other than, stay tuned. We're working on this. We're trying to get really good prices for the lab tests and for the supplements, and we're really not going to try gouging our patients. We're really wanting to give them a really good rate so we can get a lot of people doing this and get them off of a lot of them. Yeah, so I'm really interested in getting people out of their chronic pain and helping them with some very effective holistic solutions to get rid of pain, and look forward to sharing this with you in the future on our next podcast. So this is Dr. Chris Banning signing off at White House Chiropractic and Nutrition.
Check us out at whitehousechiropractic.com.